Hi, my name is Samantha Brown, and I'm currently earning my dual degrees in microbiology and psychology. After graduation this spring, I will be starting medical school at the Texas Tech University Health Sciences Center School of Medicine this coming fall. The title of my thesis is Palliative Care and You: Why End-of-Life Discussions Should Be Happening Now. In my thesis, I aim to address the issue of palliative care usage in the United States. I want the reader to become invested in the story of the thesis and to take time to reflect and remember their own values as they read. I discuss the utilization of palliative care in end-of-life conversations long before death is imminent, and examine the benefits of palliative care normalization in our current healthcare system. Death is often a tragic and emotionally confusing time for families. And by beginning the conversation of end-of-life care early and normalizing it throughout the healthcare experience, we can lessen the amount of suffering endured by families, as well as by preventing unnecessary medical procedures and therefore a mounting financial burden. In my thesis, I write, our physician tells the family the facts. His MRI has shown a severe anoxic brain injury, likely from the inability to intubate early on. His pupils are dilated and fixed, with no evidence of a gag or cough. The palliative physician diagnoses him with what is called a traumatic brain injury, or a TBI, with anoxia, and the prognosis is not good. This isn't palliative care, this is late hospice. In the United States, late transition to hospice care is common, with a median duration stay in hospice being 17.4 days from Robinson and Holloway 2017. In a study conducted with 160 patients over the course of a 4-year time span, more than half of the patients were admitted within 2 weeks of death, from Diamond, Russell, and Kiriza Lacombe 2016. While in some cases, late palliative care is a harsh reality, for example, in the event of a traumatic accident, there are many times in which multiple comorbidities or past health concerns provide for ample opportunity to begin discussing goals of care, as well as end-of-life care. Even in traumatic situations, the ease into palliative care could be met with considerably less ambiguity by introducing the palliative team to the family upon arrival and acting as the patient and their family's advocate and voice. By allowing palliative care to be utilized in a person-centered, meaningful, and supportive way, we must begin by allowing palliative to be involved at the start of a conversation rather than at the end. Embracing the end of life with palliative care could be the equivalent of going home, seeing a familiar face where emotion, love, and communication can grow. Overall, this experience has been one of the most daunting and yet informative and important examinations into the world of medicine I have ever performed. Despite years of experience working and volunteering in medical settings, nothing has really opened my eyes to the reality of end-of-life care quite like this thesis has allowed me to do. I will be moving forward into medical school with a clearer image of myself, my values, and my future medical practice. I would like to thank my thesis director, Dr. John Culberson, from the Department of Family and Community Medicine at Texas Tech University Health Sciences Center School of Medicine, for his amazing insights and helpful point of view. I would also like to thank my second reader, Ms. Jana Sweetman, RN, a charge nurse of the Trauma and Surgical Intensive Care Unit at University Medical Center in Lubbock, Texas. I would like to thank her for always allowing me to peer into her brain and ask her questions, and for volunteering to be my second reader despite her crazy busy schedule. I would also like to thank Dr. Kurt Caswell for always staying on top of my progress and helping me find my direction, as well as Dr. Michael San Francisco for taking the time to read and reflect on my thesis. I'm so thankful for all the support that has been shown to me during this time. Thank you so much for listening.